If the sensation in your hands and feet resembles being pierced by countless minuscule pins, please pause whatever you're occupied with and pay close attention. What I'm prepared to reveal assisted one of my 67-year-old patients in restoring sensation to her fingertips within merely 14 days. Relying on an item likely sitting inside your own bathroom cabinet already. My name is Dr. Sandra Serret, and across the last 15 years, I've cared for hundreds of individuals past age 60 grappling with peripheral nerve injury. What truly distresses me is that the majority of those enduring prickling, loss of feeling, and that persistent scorching feeling in their arms and legs remain completely unaware that a straightforward remedy exists, one capable of transforming their situation in as few as 2 weeks. Right now, I'm going to lay out precisely which member of the B vitamin family is essential, the reason it proves effective, the appropriate dosage to use, and the major error that most individuals in their senior years commit, blocking them from achieving any improvement. Before we proceed further, please reflect for a moment. Are any of these red flags familiar to you? Do your hands or feet start prickling just as you're settling down to rest? Do you struggle to distinguish between warm and chilly water through touch? Have fastening buttons grown increasingly difficult? Do you sense instability or wobbliness while moving about on your feet? Or perhaps you've become aware of that unrelenting heated discomfort that refuses to subside. Why nerves lose their protective coating after 60? If your response was affirmative to even a single one of those descriptions, then your nervous system is urgently signaling distress. And here's a reality that far too many physicians fail to mention openly. This goes far beyond mere annoyance or inconvenience. When peripheral nerve impairment goes unaddressed, it risks resulting in irreversible sensory loss, heightened chances of stumbling or falling, and a profound deterioration in overall daily well-being. Yet stay right here with me, since the approach to resolution turns out far less complicated than one might assume. Allow me to clarify the precise process unfolding within your physiology at this very moment. Your neural pathways function much like insulated electrical cables distributed across your entire frame. They transmit directives outward from the brain toward your fingertips, your toes, and all points in between. But the difficulty arises here. Those neural pathways possess an outer insulating layer. Picture it as comparable to the outer plastic sheath encasing a standard electrical cable. Once we reach advanced age, particularly beyond the age of 60, our system's capacity to preserve and sustain that insulating sheath diminishes sharply. And once that sheath deteriorates, the nerves sustain injury, lie unprotected, and begin sending erratic impulses. Precisely that malfunction produces the prickling sensations, the deadened areas, and the discomfort. Now, this is the particularly noteworthy part. A single, particular variety within the B vitamin group stands as absolutely indispensable for your system to restore and preserve that crucial insulating sheath. Absent sufficient quantities of it, neural recovery remains impossible. With adequate supply, genuine reversal of the impairment becomes achievable. The nutrient in question is vitamin B1, known scientifically as thiamine. And prior to dismissing this as merely another passing trend in nutritional supplementation, permit me to recount a few observations from my own clinical experience. Within my practice, individuals who previously found themselves incapable of gripping a mug of coffee securely without it slipping from their grasp have managed to recover complete grip strength in their hands. I've observed patients who lost all tactile awareness in their soles, while ambulating regained steadiness and assurance in their stride. I've seen those convinced their prime years had passed forever return to pursuits such as tending gardens, preparing meals, and even enjoying dance once more. Such outcomes occur far from rarely. They manifest consistently whenever individuals secure sufficient quantities of B1. The nerve fuel. Why vitamin B1 thiamine is the answer. In reality, the human organism possesses remarkable recuperative power. Your neural structures possess an innate drive toward repair. They are biologically engineered for restoration, yet they require appropriate nourishment to carry out that process, and vitamin B1 serves precisely as that nourishment. This involves no mystical element whatsoever. It consists simply of supplying the organism with the very element it urgently requires. Consider the analogy of an automobile engine deprived of lubricating oil over time. It inevitably suffers breakdown. Components rub abrasively against one another, degrade progressively, and cease proper operation. In analogous fashion, B1 functions as lubrication for the entirety of your neural network. It ensures seamless performance throughout. It safeguards the transmission lines. It facilitates unimpeded passage of neural impulses originating in the brain and reaching every region of the physique. In circumstances of inadequate B1 availability, operating your neural apparatus equates to running it while depleted. Impulses become distorted. Signals fire inaccurately. That familiar prickling or needle-like discomfort emerges. Hands lose sensation, feet register as virtually absent. Locomotion grows frightening due to absent feedback regarding foot placement. Objects are collided with because bodily signaling grows disordered. However, upon providing the precise quantity of B1 demanded, recuperative mechanisms activate nearly at once. Reconstruction of the insulating sheath commences. Impulses resume clear transmission. Areas of numbness gradually diminish. Patients frequently liken the experience to illumination gradually returning within a space long shrouded in shadow. Many describe rediscovering their authentic sense of self after years of absence. Now you may find yourself reflecting, Dr. Serret, discussions regarding B vitamins have reached my ears previously. Surely my regular eating habits supply ample amounts, correct? My dietary choices remain wholesome. I maintain diligent self-care. Permit me to present the startling actuality. A substantial proportion of adults beyond age 60 exhibit insufficiency in B1, and the great majority remain oblivious to the fact. Research indicates that as many as one-third of senior citizens fail to obtain sufficient B1 solely through dietary intake. Those figures worsen considerably among individuals using particular pharmaceutical agents. Three primary factors explain this phenomenon, factors seldom discussed openly. The silent thief. Why 1 in 3 seniors are deficient. Firstly, advancing years bring reduced gastric acid production, thereby impairing efficient uptake of B1 derived from ingested foods. Despite consumption of optimal food sources, the organism may capture merely a small portion of available B1 content. Imagine possessing a sponge that has forfeited its capacity to retain moisture. You could apply liquid endlessly, yet it simply flows away unused. A vigorous individual at age 30 might assimilate 60–70% of dietary B1, whereas past age 60, that efficiency frequently plummets to only 20–30%. Identical nutritional input yields far less usable nutrient due to physiological changes. Secondly, numerous widely prescribed medications actively interfere with B1 uptake. Should your regimen include agents for managing blood sugar, especially one termed metformin, or diuretics prescribed for hypertension management? Such compounds can substantially diminish circulating B1 reserves. Certain remedies addressing gastric reflux produce comparable depletion. While these pharmaceuticals alleviate one condition, they quietly engender another. Warnings about this interaction remain conspicuously absent in most cases. Within my practice, I've encountered individuals prescribed these agents continuously for a decade or longer, without ever undergoing assessment of B1 status. Over extended periods, peripheral nerve compromise develops insidiously, and observers commonly attribute it to inevitable aging processes, yet the true culprit frequently proves correctable through nutritional correction. Medications that secretly drain your B1 levels, and thirdly, consumption of foodstuffs naturally abundant in B1, such as unrefined cereals, legumes, and lean cuts of pork, may yield only minimal effective absorption owing to diminished digestive efficiency accompanying age. Furthermore, contemporary methods of food refinement eliminate substantial B1 content from numerous products. Items including refined white flour products, polished rice varieties, and heavily processed edibles essentially contain negligible amounts of this nutrient. To illustrate concretely, consider one gentleman under my care named Robert. At 71 years of age, he maintained exceptional health awareness. Daily walking formed part of his routine, vegetable intake remained abundant, and avoidance of unhealthy fare stayed consistent. He adhered faithfully to standard medical guidance. Nevertheless, he presented reporting progressive foot numbness intensifying weekly. He described the persistent impression of traversing surfaces while wearing heavily padded footwear. Driving became hazardous due to absent sensation on accelerator and brake controls. Concern mounted regarding possible grave underlying issues, perhaps diabetic sequelae or circulatory compromise. Laboratory evaluation revealed perilously diminished B1 concentrations. Inquiry into concurrent pharmaceuticals disclosed ongoing use of an antidiabetic agent alongside a diuretic, both maintained for many years. Those agents had silently eroded his B1 stores throughout that duration, unnoticed and unmonitored. Intervention commenced promptly with B1 supplementation. Within 3 weeks, he contacted me nearly overcome with emotion, stating, "Dr. Serret, tactile awareness has returned to my feet. Ground contact registers clearly during ambulation. The accelerator pedal feels distinct once more. Stability and self-assurance re-emerged. He likened the transformation to restored illumination throughout his physique. Fear-free canine companionship walks resumed. Secure motoring capability returned. That moment crystallized for me the extent of unnecessary suffering endured by countless individuals. How frequently do people navigate daily life bearing unrecognized low B1 status, enduring progressive nerve compromise, without anyone establishing the connection, without anyone conveying knowledge of this elementary corrective measure? They persist in discomfort, accepting it as standard consequence of chronological advancement. Therefore, should you find yourself beyond age 60 while encountering any manifestation of prickling, sensory loss, heated discomfort, or diminished strength, securing evaluation of B1 status becomes imperative, because each passing day of insufficiency inflicts incremental neural harm, rendering reversal progressively more challenging with delay. Promptly identified compromise often reverses swiftly. Prolonged compromise demands extended periods for meaningful recovery. Additionally, insufficient B1 exerts influence extending beyond peripheral nerves alone. It impacts vitality levels, emotional equilibrium, cognitive clarity, and postural stability. Certain individuals attribute persistent fatigue solely to advancing years, when heightened B1 availability might resolve the issue. Others experience mental cloudiness and recall difficulties, fearing cognitive decline when this solitary nutrient could restore sharpness. Here's precisely the protocol demanding your careful adherence, since particulars hold genuine significance. Step 1 involves selecting the appropriate variant of B1. Not every supplemental form delivers equivalent benefit. This distinction proves vital. Seek specifically the variant designated benfotiamine. That formulation permits immediate utilization by the organism without preliminary conversion steps. Conventional thiamine undergoes rapid degradation within gastric environs prior to reaching neural targets effectively. In contrast, benfotiamine persists considerably longer systemically and demonstrates superior efficacy toward neural restoration. It exhibits targeted delivery characteristics favoring nervous tissue. Upon visiting retail outlets or browsing digital marketplaces, examine packaging labels meticulously. Search explicitly for the designation benfotiamine, spelled BNFOTIAMIN. Should labeling indicate merely thiamine absent further specification, benefit remains possible, yet benfotiamine confers markedly enhanced potency specifically for neural applications. Investing marginally greater cost proves worthwhile to secure optimal formulation. Avoid compromising quality here. The exact dosage and the benfotiamine secret step 2 concerns obtaining proper dosing quantity. For purposes of neural restoration, therapeutic administration ranges between 150 milligrams and 300 milligrams of benfotiamine each day. That constitutes the effective range for addressing compromised neural integrity. Encouragingly, B1 qualifies as water-soluble, meaning surplus quantities beyond immediate requirement undergo excretion via urinary pathways. Excessive intake poses no hazard. Physiological mechanisms regulate utilization intelligently. Documented instances of genuine B1 toxicity remain non-existent. Severe insufficiency warrants initiating at 300 milligrams. Milder presentations may respond adequately to 150 milligrams. Nevertheless, the preponderance of individuals exceeding age 60 presenting neural symptomatology require the upper therapeutic threshold 300 milligrams to observe substantial progress. Robert's story, From Numbness to Feeling the Pedals Again, Step 3 pertains to optimal administration vehicle. Conventional oral tablets containing B1 function adequately. However, superior bioavailability accompanies lipid-compatible formulations such as benfotiamine. Absorption improves notably, particularly amid digestive challenges. Consume alongside meals incorporating modest lipid content. Examples include eggs, avocado portions, or assorted nuts. Lipid presence enhances uptake efficiency. Avoid ingestion absent accompanying food lest minimal absorption occur. Step 4 addresses consistent timing. Administer daily B1 during morning hours concurrent with breakfast consumption. Since B1 contributes energizing effects, morning placement optimizes benefit. Evening dosing risks sleep disruption through heightened alertness. Position the container adjacent to your customary coffee preparation area or breakfast setting. Render omission virtually impossible. Integrate it seamlessly within established morning habits, comparable to dental hygiene routines. Employ electronic alerts if memory support proves helpful, because unwavering regularity determines success entirely. Daily uninterrupted intake remains non-negotiable. Physiological demand for B1 persists continuously. Intermittent provision yields inconsistent outcomes. 3 consecutive days of omission can decelerate or partially undo accumulated advancement. Now consider realistic anticipations upon commencing appropriate B1 administration, utilizing correct variant alongside suitable quantity. During initial week 1, heightened vitality frequently manifests prior to perceptible neural shifts. Numerous individuals report diminished mental haziness within mere days. Cognitive acuity sharpens noticeably. Mornings bring refreshed awakening rather than labored emergence. Mood enhancement surfaces for some. Week 2 frequently introduces preliminary indications of neural recovery. Perhaps reduced intensity of morning hand prickling occurs, or feet register somewhat more naturally during movement. Such subtle alterations signal awakening and commencement of neural repair processes. Weeks 3 and 4 typically bring increasingly evident, sustained enhancements. Persistent prickling diminishes markedly. Tactile discrimination of surface qualities improves upon contact. Postural steadiness increases during locomotion. Dropped objects decrease in frequency. Household mobility inspires greater assurance. During months 2 and 3, truly transformative progress commonly emerges, profoundly influencing routine existence. By this stage, the majority describe themselves as fundamentally altered compared with pre-intervention status. Persistent heated discomfort vanishes. Sensory loss improves dramatically or resolves entirely. Previously abandoned leisure pursuits resume. Activities once shunned become feasible once more. Now permit me to recount Margaret's experience. The 67-year-old individual referenced initially. Margaret arrived visibly distraught, genuine tears streaming. She could no longer perceive her grandchildren's grasp within her own palms. Frequent accidental release of household items, drinking vessels, dishware occurred. Her mobile device sustained cracks on 3 separate occasions. Dread of forfeiting autonomy and imposing upon loved ones consumed her. Ambulation provoked sensations akin to instability upon watercraft. 2 falls had occurred within recent 6 months, one within kitchen confines, another across parking surfaces. Daily assistance from her daughter became necessary for managing fastenings. Having devoted 4 decades to tailoring elaborate bridal gowns, Margaret now found herself unable to secure her own garments. Embarrassment, exasperation, and profound sorrow overwhelmed her. Laboratory assessment confirmed profound B1 insufficiency, levels perilously reduced. Immediate commencement of 300 mg benfotiamine daily ensued. Within 14 days, discernible difference emerged. Hands regained vitality. By 6 weeks, independent fastening of attire resumed without assistance. Tears accompanied her recounting of that seemingly trivial yet profoundly meaningful restoration of self-reliance. Within 3 months, resumption of knitting and needlework occurred. She presented me with an exquisite handcrafted scarf, declaring it her expression of gratitude for restoring vitality to her existence. Yet truthfully, restoration originated not from my efforts, but from adequate B1 availability combined with inherent physiological recuperative capacity. I merely directed attention toward appropriate intervention. Margaret endured unnecessary struggle across 2 full years prior to consultation. Prolonged suffering proved avoidable. Virtually no one need endure it, yet widespread unawareness of this elementary corrective pathway persists. Before concluding, 3 essential cautions merit emphasis for safeguarding well-being. Warning 1. Pursue appropriate diagnostic evaluation prior to initiation. Request comprehensive blood analysis encompassing B1 status from your healthcare provider. Confirmation of actual insufficiency guides appropriate intervention while permitting objective monitoring of advancement. Avoid presumptive approaches. Secure verified baseline data. Warning 2. Select medical conditions necessitate professional oversight. Presence of renal compromise or polypharmacy warrants prior consultation with your physician before introducing supplementation. For the vast majority, B1 demonstrates excellent safety and tolerability. Nevertheless, confirm appropriateness amid significant comorbidities. Warning 3. Pharmacological interactions warrant recognition. Agents addressing blood glucose regulation or fluid balance may actively diminish bodily B1 reserves. Informing your prescriber of supplementation enables appropriate surveillance and potential regimen modification. Certain pharmaceuticals and B1 exhibit counteractive tendencies. Importantly, efficacy maximizes through synergistic combination with companion B vitamins, most notably B6 alongside B12. These nutrients operate collaboratively, mutually reinforcing function, and enhancing overall efficiency within physiological contexts. Therefore, rather than isolated B1 administration, contemplate a comprehensive, high-quality B-complex formulation incorporating benfotiamine as the B1 component. Seek preparations delivering minimum 100 mg B6 together, with at minimum 1,000 micrograms B12. Such combined approach yields particularly robust support for neural integrity and accelerates optimal outcomes. Why food alone isn't enough after age 60, I fully comprehend the anguish accompanying observation of cherished individuals contending with neural compromise. My own mother encountered precisely this challenge during her early 70s. Nocturnal prickling disrupted rest, fear inhibited descent of staircases. The situation proved devastating. Upon identification and correction of her B1 insufficiency, profound transformation ensued. Confidence returned, autonomy reemerged. That personal experience fuels my dedication to disseminating this information widely. Existence need not involve ongoing neural compromise. Acceptance of prickling and sensory loss as inevitable accompaniments of aging proves unnecessary. Innate physiological recuperative mechanisms remain extraordinarily capable. Provision of appropriate resources suffices. Vitamin B1 constitutes one indispensable resource among them. All right, here stands your concrete implementation strategy. Record these elements immediately. Your 4-week neural restoration protocol. Week 1, complete laboratory assessment including B1, B6, and B12 quantification. Simultaneously initiate daily benfotiamine between 150–300 mg. Commence supplementation without awaiting results. Week 2, incorporate comprehensive B-complex preparation featuring benfotiamine as B1 source, minimum 100 mg B6, and minimum 1,000 micrograms B12. Administer mornings alongside breakfast. Weeks 2 through 4, maintain straightforward symptom documentation. Assign daily numerical ratings 1-10 scale to prickling and numbness severity. Tracking facilitates recognition of incremental advancement. Week 4, schedule physician follow-up. Reassess laboratory values and evaluate clinical progress. Additional recommendations: always pair B1 ingestion with food intake. Minimize or eliminate alcohol consumption. Incorporate naturally B1 abundant selections including unrefined grains, legumes, and lean pork varieties. Maintain adequate hydration, target 6 to 8 glasses water daily. This systematic approach has benefited hundreds within my patient population. Comparable benefit awaits you. Should this presentation prove valuable, kindly extend it towards someone beloved who has surpassed age 60. Such knowledge holds potential to profoundly alter their experience. Fresh instructional content appears weekly addressing principal health considerations relevant to mature adults. Activate subscription alongside notification preferences to ensure consistent access to vital material of this nature. This concludes from Dr. Sandra Sarat. Recall always, your most fulfilling chapters need not reside solely in retrospect. Equipped with accurate understanding coupled with decisive implementation, reclamation of comfort, assurance, and self-sufficiency becomes entirely attainable. Commence nurturing those neural pathways today. Supply the B1 they so urgently require until our next encounter. For complementary wellness guidance and regular dietary frameworks mirroring these principles, become part of our WhatsApp network immediately. Utilize the displayed QR code or access the provided description hyperlink. Maintain well-being, preserve joy.